Good morning, students. Welcome you all to yet another session for the NPTEL online certified course on the topic an overview on maternal health, the antenatal, intranatal and postnatal care. I am Dr. Bornali Ghosh, an obstetrician and gynecologist working as assistant professor at Bisinoy Multi-Speciality Hospital and Medical Research Center, IIT Kharagpur. So, we have been discussing the mechanism of normal labor, where we have already discussed the first cardinal movements, that is the descent, first the engagement, then the descent, then flexion and internal rotation. And we have also seen the theories involved, or theories which we scientifically explain the events of flexion as well as internal rotation. Now, continuing with this flexion and internal rotation, what happens due to this internal rotation of the head? So, due to this internal rotation of the head, so you can see here. So, we have discussed that the internal rotation of the head will occur in such a way that this occiput, this is the occiput. So, the occiput was actually in the left occiputo anterior position. So, this occiput was in the left, pointing towards the left iliopubic eminence, right. So, with internal rotation of the fetal head, this occiput will now rotate by 1/8 of a circle, that is 45 degrees, and such that the occiput comes behind the symphysis pubis. So, the head rotates, but to note that the shoulders, these are the shoulders. So, the shoulder, there is no movement of the shoulders. So, the head rotates, head is rotating, but the shoulder, there is no movement, right. So, there is a torsion in the neck due to this internal rotation. There is a torsion in the neck, and this neck can sustain a torsion of 1/8 of a circle, not more than that. So, if the rotation of the head was more than 1/8 of a circle, as in case of LOT, that is left occipitotransverse, where the occiput is towards the directed transversely. So, now it has to move by 2/8 of a circle, right, by 2/8 of a circle or 90 degrees, so that the occiput now becomes anterior and it hinges behind the symphysis pubis. So, at that time there will be a torsion in the neck by 1/8 of a circle, and because the neck cannot sustain a torsion of more than 1/8 of a circle, there will be associated movement of the shoulders also by 1/8 of a circle for the extra 1/8, right. So, a torsion, just to know that in left occiputo anterior, due to internal rotation of the fetal head by 1/8 of a circle, there is a torsion in the fetal neck, right. And so, that is the torsion of the neck. Now, coming back to the slides. So, there is a torsion in the neck, and this is because of the internal rotation of the head, right. Next, what happens? Next is delivery of the head. So, delivery of the head. So, there is a phenomenon called as crowning. What is crowning? So, this is the occiput. So, now after the internal rotation, the occiput is just behind the symphysis pubis, right. So, this is the pubic symphysis, occiput is behind the symphysis pubis, and now with the pushing effect, right. What is that pushing effect? The uterus is contracting and it is pushing the fetus down, and the perineal muscles the perineal muscles, the vaginal soft tissue, all these will give a resistance. All these will give a resistance, and that will be an upward pressure as well as a forward pressure. This upward pressure negates the downward pressure of the fetal descent due to the uterine contraction. So, the downward and upward pressure will neutralize, and the forward pressure will lead to the delivery of the head. And what is crowning? Crowning is that phase when the biparietal diameter crosses the pelvic outlet, and the vaginal, the valval outlet is is stretched by the fetal head, and you can see the fetal head, right, and it is not receding back. The fetal head is not receding back into the uterine cavity even during the period of uterine relaxation. So, that is crowning, right, and at this point of crowning, episiotomy is to be given. So, next, after crowning, the fetal head is delivered. This is the delivery of the fetal head by the process of extension. So, the occiput will hinge below the pubic symphysis. This is the pubic symphysis, and gradually by the process of extension, the fetal head was in flexion, and now by the process of extension, gradually the vertex, the sinciput, vertex, say this is the vertex, this portion, this is the sinciput, this is the brow, this is the chin. So, slowly the vertex, sinciput, brow and chin is delivered, right, by the process of extension. This is the delivery of the head. Next is restitution. Restitution is in a direction opposite, to that of internal rotation of the head, right. Thereby, this is due to untwisting of the neck. So, there was a torsion in the neck of 1/8 of a circle, and this torsion is now relieved by the process of restitution, and this process of restitution is in opposite direction to that of internal rotation. And now the fetal head, in case of left occipito-anterior, the fetal head will now look towards the maternal right thigh, opposite thigh. It was left occipito-anterior, and as restitution has occurred in a direction opposite to that of the internal rotation, so it will look towards the right thigh of the mother, obliquely. So, this is restitution. This is a passive movement, just untwisting of the neck, thereby relieving the torsion in the neck, right. So, this is what I was explaining, internal rotation. If it is 90 degree, that is by 2/8 of a circle, in case of LOT or occipito-transverse position, LOT or ROT. So, in the neck, the torsion, that is with the neck can withstand a torsion of 1/8 of a circle, and the other 1/8 of a circle is corrected or is along with the rotation of the fetal shoulders, right. So, after delivery, the restitution occurs in a direction opposite to that of the direction of the internal rotation, and this restitution is by 1/8 of a circle. And other external rotation, this is due to the internal rotation of the shoulders. We will come to this. So, restitution, you have understood, it is due to the untwisting of the neck, the torsion in the neck. Next is external rotation. I have told this is due to the internal rotation of the shoulders. Now, there will be, the head is already delivered. the shoulders need to be delivered. The shoulders will now negotiate through the pelvic cavity. It will undergo rotation by 1/8 of a circle. The anterior shoulder will come behind the symphysis pubis and making the anterior shoulder as the fulcrum, right? It will slide below the symphysis pubis, and the posterior shoulder will be delivered by the process of lateral flexion, right? And the rest of the body will get delivered, expulsion of the trunk or rest of the body will get delivered by the process of lateral flexion. So, these were all the steps of normal labor. Now, I will show it one by one in this demo. So, we have this fetus, and this is a case of longitudinal lie, cephalic presentation, presenting part being the vertex. So, that means attitude is well flexed, right. So, attitude is well flexed, presenting part being the vertex and denominator being the occiput, and your position is left occiputo anterior. So, that means the occiput is behind the left iliopubic eminence, but most commonly engagement occurs in left occiputo transverse, where the occiput is towards the transverse diameter, right. But left occiputo anterior is also common, and we will discuss here the left occiputo anterior. So, this is the position of the fetus. Now, as the labor onset starts, there is engagement. What happens? The maximum biparietal diameter that or maximum transverse diameter, that is the biparietal diameter, crosses the pelvic brim, right. It crosses the pelvic brim, and the transverse diameter is in the right oblique diameter, and the engaging anteroposterior diameter, which is the subocciputobregmatic, is in the left oblique diameter. Now, their engagement has taken place, that is the biparietal diameter has crossed the pelvic brim. Now, with further uterine contraction and retraction, there is further descent of the fetus, right. And then the fetal head will reach the pelvic floor. The occiput will touch the pelvic floor, and by the process of internal rotation, this occiput will move by 1/8 of a circle, such that the occiput now comes behind the symphysis pubis, right. You can see. So, occiput now comes behind the symphysis pubis, right. So, this is brought about by the internal rotation of the fetal head. Now, the shoulders which were in the right oblique plane, there is no movement of the shoulders, but due to this internal rotation, there is a torsion in the neck by 1/8 of a circle, right. Now, with further descent, the occiput will now come below the symphysis pubis, right. So, occiput now comes below the symphysis pubis, and by the process of extension, what happens? By the process, here there is some cephalopelvic disproportion. So, it is not being negotiated, but I will show you. So, now the head delivery will occur. Okay. So, now the head delivery will occur. So, now by the process of extension, the first the occiput, then the vertex, then the sinciput or the brow, then the face and the chin is delivered by the process of extension. So, this is the delivery of the head. After the delivery of the head, what will happen? The chin will just press against the maternal anal opening. after the delivery of the head by the process of extension, now there will be restitution, right. So, restitution will be in the direction opposite to that of internal rotation of the head, thereby relieving the torsion in the neck, right, and it will be so that the fetal head now faces the right thigh of the mother obliquely, right. So, that was the delivery of the head followed by restitution. Now, you can see the shoulders. The shoulders are in the right oblique diameter. Now, with further descent, the anterior shoulder, this is the anterior shoulder will touch the pelvic floor, and by the same method it will rotate. The anterior shoulder will rotate by 1/8 of a circle, such that the anterior shoulder now comes behind the symphysis pubis, and due to this internal rotation of the anterior shoulder, so here the anterior shoulder is getting rotated, and that will be manifested by the external rotation of the fetal head. The anterior shoulders are getting internally rotated by 1/8 of a circle, and the head will rotate in the same direction as that of restitution by 1/8 of a circle, thereby the fetal head is facing the right thigh of the mother directly. Now, the anterior shoulder is hinging behind the pubic symphysis, acting as a fulcrum. The posterior shoulder will slide against the perineum, and it will be delivered by the process of lateral flexion. The rest of the body of the fetus is delivered by the process of lateral flexion. So, that was the steps of normal labor and the different movements taking place within the fetus to adapt itself through the maternal pelvis, right. So, coming back to our slides, so these are the diagram. So, here first engagement is taking place, and see the engagement is taking place in posterior asynclitism position, right. Then it will be corrected as it is descending, the fetal head is descending, the posterior asynclitism is corrected, and the head is now in synclitism position. With further descent, there is rotation, and see now this bregma will go behind. So, there is rotation, and the occiput will come behind the symphysis pubis, and there will be delivery of the fetal head by the process of extension, right. So, just in a nutshell, the steps of normal labor: first, engagement. With engagement, it goes down the pelvic brim, the biparietal diameter crosses the pelvic brim, and with further descent there is increasing flexion. Along with descent there is increasing flexion, right, due to the resistance given by the pelvic floor muscle, the unfolding cervix, as well as the birth canal, right. So, there is increasing flexion. Next is internal rotation. After flexion, there is internal rotation of the occiput, and if it is more than 1/8 of a circle, then there is simultaneous rotation of the shoulders, because in the neck torsion can be withstood only up to 45 degrees, that is 1/8 of a circle. Next, there will be crowning and delivery of the head by extension. Following the delivery of the head, the torsion in the neck will be corrected by restitution, right. So, in the direction opposite to that of the internal rotation of the head. Now, the external rotation of the head occurs, which is actually due to the internal rotation of the shoulders, and the shoulders now come in the anteroposterior diameter, with the anterior shoulder coming just behind the pubic symphysis. It will slide against the pubic symphysis and the posterior shoulder will be born, right? Delivery of the shoulders and the trunk by the process of lateral flexion. So, this was the full detailed structure of mechanism of normal labor. And in all this process, descent occurs right from the start to the end. The descent occurs and thereby the fetus is born out through the birth canal into the outside world. So, that was regarding the steps of normal labor, just a pictorial diagram. So, this is the first part, that is engagement taking place. So, here you see this is the pelvic brim and engagement is biparietal diameter crossing the pelvic brim, right. Then there is descent, and then there will be flexion and internal rotation. So, here you can see. So, there is flexion and this occiput is in the left occipito-anterior. So, there will be internal rotation and this occiput will come anteriorly just behind the pubic symphysis. So, this is internal rotation of the head, right. Next, what happens? There is delivery of the head by the process of extension, right. Head is delivered and now what will happen? There will be restitution, thereby relieving the torsion in the neck, and then there will be external rotation due to the internal rotation of the shoulders, thereby the shoulders coming just below the pubic symphysis, and the anterior shoulder will hinge below the pubic symphysis and the posterior shoulder and rest part of the body will be borne by the process of lateral flexion. So, these are the cardinal movements occurring in case of normal labor. So, that was all regarding the mechanism of labor. References mostly have been taken from Desidatta book of obstetrics, Williams Obstetrics 26th edition, James book on high risk pregnancy, and also the Oxenford book on labor, right. So, go through these books at least once you give a reading to this chapter, because this is very important, and to go for vaginal delivery in any obstetric patient, you need to know these steps, and if in any stage there is some deviation from this normal process of labor, it is called as labor dystocia or abnormal labor, and in that case intervention should be done, right. So, if the fetal head is not in complete flexion, it is extended somewhat, it gets corrected, right, with the process of labor, with uterine contraction, with the adaptations of the fetus through the birth canal, most of the abnormalities get corrected. That will lead to the process of vaginal delivery ultimately. But sometimes when it does not get corrected, then we have to intervene and help in the delivery of a normal healthy fetus as well as a normal healthy mother at the end of the delivery. So, that was all. Thank you for your patient hearing, and we will keep on discussing this intranatal care in our further classes. Thank you.